Transcatheter mitral valve repair in patients with heart failure. Transcatheter mitral valve repair provides a minimally invasive alternative that can improve your quality of life without open heart surgery. TNVR, particularly H2H leaflet repair, is a well-established alternative for patients with severe primary mitral regurgitation, considered at high or prohibited surgical risk. More recently, transcatheter mitral valve replacement (TMVR) has emerged as a potential therapeutic option for the treatment of severe MR. TMVR may offer some advantage over transcatheter repair by providing a more complete and reproducible MR reduction.
The prognosis in patients with heart failure and secondary mitral regurgitation is poor, although surgical mitral valve repair and replacement have not been shown to reduce hospitalizations or death. Transcatheter mitral valve repair may improve clinical outcomes. In this multi-center randomized controlled open-label trial, 614 patients with heart failure and moderate to severe or severe secondary mitral regurgitation who remain symptomatic despite maximal medical therapy were randomized to transcatheter mitral valve repair plus medical therapy or to medical therapy alone. The primary efficacy endpoint was all hospitalizations for heart failure within 24 months. The primary safety endpoint was freedom from device-related complications at 12 months. A key pre-specified secondary endpoint was all-cause mortality within 24 months. The annualized rate of all hospitalizations for heart failure within 24 months was significantly lower in the device group than in the control group. At 12 months of follow-up, 96.6% of patients in the intervention group were free of device-related complications, exceeding a pre-specified threshold. All-cause mortality within 24 months was lower in the device group than in the control group. The authors conclude that among patients with heart failure and moderate to severe or severe secondary mitral regurgitation who remain symptomatic despite maximal medical therapy, transcatheter mitral valve repair may improve clinical outcomes. Full trial results are available at nejm.org.
Application in medicine. In patients with heart failure and left ventricular dilatation, mitral regurgitation may develop as a result of geometric dislocation of the papillary muscles, anteriorating the knee, impairing captation of the mitral leaflet. Such secondary functional mitral regurgitation increase the severity of volume overload and has been strongly associated with decreased quality of life, an increased rate of hospitalization for heart failure, and short survival.
The four valves in your heart keep your blood flowing forward. Located between your left atrium and left ventricle, your mitral valve controls the blood flow between these two chambers and stops blood from flowing back into the left atrium when the left ventricle contracts. The mitral valve is composed of a front portion, known as the anterior leaflet, and a back portion, known as the posterior leaflet. A fibrous ring of tissue, called the annulus, surrounds the mitral valve. This maintains its shape and helps ensure that the leaflets close completely. Tendinous cords anchor the leaflets to small projections in your left ventricle, called papillary muscles. If you have mitral valve disease, your posterior leaflet enlarges and projects or prolapses into the left atrium. This may result from your cords elongating or rupturing. The damaged valve allows blood to leak or regurgitate back into your left atrium. The only way your left ventricle can compensate for this condition is by enlarging and pumping more volume. This causes your mitral orifice to enlarge, preventing your leaflets from closing properly. To treat this condition, your doctor may suggest a type of minimally invasive procedure called robotic mitral valve repair. Your surgeon will begin the procedure by making 5 small incisions on the right side of your chest. A second surgeon will insert a special camera called an endoscope and other tools attached to the robotic arms through the incisions. These robotic instruments allow the surgeon a wider range of motion and more precision than the normal human wrist. In order to perform your operation safely, the surgical team will stop your heart and place you on a heart-lung machine. This machine takes over the functions of these organs during your operation. A tube, called a cannula, will be inserted into your right groin, draining blood from your heart into the heart-lung machine. The machine will oxygenate your blood and pump it back into your body through another cannula inserted through a small incision in your left groin. Seated at the robotic console, your surgeon will operate the robotic arms and the camera with hand controls and foot pedals. This computerized system will translate the exact movements of your surgeon's hands into precise movements of the robotic instruments. Your cardiac surgeon will have a magnified three-dimensional view inside your body through a high-definition binocular display. Your surgeon will then make an incision in your left atrium to get to the mitral valve. There are different types of repairs depending on the condition of your mitral valve. A posterior leaflet repair is one of the most common types. During the repair process, your cardiac surgeon will most often remove part of the prolapsed portion of your valve and will suture together the remaining tissue. Your cardiac surgeon will also correct the enlargement of the mitral orifice by suturing a firm band or ring to the mitral annulus. Robotic mitral valve repair is the least invasive and the most precise technique available to treat mitral valve disease. The benefits for patient include no splitting of breastbone, less pain because of no retraction of the chest wall, lower risk of infection and bleeding, allows for high-precision complex mitral valve repair, shorter hospital stay, quicker recovery and return to activity, and significantly better cosmetic results.
Pros and cons. Advantage. Guideline-directed medical therapy and cardiac resynchronization therapy may provide symptomatic relief, improve left ventricular function, and in some patients, lessen the severity of mitral regurgitation. Disadvantage. Although mitral valve surgery is curative for primary degenerative mitral regurgitation, neither surgical repair nor surgical replacement of the mitral valve has been shown to lower the rate of hospitalization or death associated with secondary mitral regurgitation, and both results confer a substantial risk of complications. Issue applied in Ecuador. It is estimated that more than 199,000 Ecuadorians have heart failure. In Ecuador, the impact of cardiovascular disease is quite significant. It is estimated that about 14% of the Ecuadorian population, 1.4 million people, live with some heart disease, hypertension, myocardial infarction, atrial fibrillation, and heart failure. Of these, it is estimated that more than 199 millions have heart failure each if without adequate medical support or treatment, according to a report prepared by Deloitte called The Economic Burden of Heart Conditions, Ecuador. In addition, according to this document, it is estimated that 1 in 2 patients will die in the 5 years following diagnosis, a surprising situation because of this pathology is preventable in most cases. In addition, the cost of heart failure in 2015 was 228 million in Ecuador. Conclusion. Among patients with heart failure and moderate to severe secondary mitral regurgitations who remain symptomatic despite the use of maximal dose of the guideline-directed medical therapy, transcatheter mitral valve repair results in a lower rate of hospitalization for heart failure and lower all-cause mortality within 24 months of follow-up than medical therapy alone. The rate of freedom from device-related complications exceeds a pre-specified safety threshold.
There's a lot of bicyclists, and I get to know a lot of them because I try to come over here and are quiet quite a bit. We can go a little bit slower, right? Let's just take a minute. And then we...
He's got severe aortic stenosis, which is a narrowing of the heart valve, so blood can't get out of the heart. Blood backs up into the lungs, and patients become short of breath with exertion.
There's quite a difference in this man from what he was before.
We can restore his life, not only lengthen it, but we can restore it back to health. He's an avid cyclist who actually cycled clear across the United States.
We had to average 85 miles a day. And I was 68 at the time.
They're going to replace my aortic valve.
I'll be able to bike the man.
Well, actually, that's not going to be too hard.
You know what? When you ride that bike, you're a kid again. And what better thing to have when you're 84 years old?
30 years, not one fight.
Maybe we better start one.
We've traveled the world together. We're just one. We're just simpatico. What more can I say? God gives you a chance sometimes, and if you grab it, you'll win.
Without him, won't be my life. Yes.
We're going to be replacing his old aortic valve with a new aortic valve without having to open up the chest. Now for Bob, this is great because he's already had open heart surgery once, and this just makes it so much easier for him. You have any questions for me?
No, I think we've talked a lot. I didn't want my chest opened again.
We thought he had no options to make his life better.
I didn't even know this was available until recently, and it hasn't been available.
Brand new.
You're right. You ready?
Every patient that walks through our doors, we really take that patient into our arms and just help them feel comfortable, them and their families.
He chose not to have this procedure. The only thing he could look forward to was progressive shortness of breath, eventually being bedridden and dying of heart failure.
Love you. Okay, you're all right. It's going to be okay. It's going to be okay. Okay?
Today's procedure in terms of complexity is a 10 out of 10. It is the most complex procedure that I do. Extremely high risk. We have 16 people in the room, 6 doctors, 4 different specialties, all working together as a team to make sure we have a great outcome for Bob.
An 80-year-old enjoys waking up tomorrow just as much as a 10-year-old. Tomorrow is all we all have.
We take this new valve and we place it on a balloon. We crimp down so we can get through the patient's arteries in his groin.
Make a little incision right here and you can do a hand.
Big tail going in.
What I do as an interventional cardiologist is I implant the valve itself.
Balloons going in.
And inject, please. Balloon up. That is the patient's new aortic valve.
Every patient is important, but just knowing what their lifestyle was like before, what they hope to achieve by getting this procedure, it really hits home for me. So when we deployed that stent, I was internally cheering.
And we'll just take a quick pressure measurement. The patients are able to go home in 2 to 3 days, and they do as well as they would have with traditional open heart surgery. That's the best thing. Let's go talk to the family. Hello, how you doing? Everything went great.
It's okay.
Everything went great. He did really, really well. Patients are able to go back to biking or go back to walking normally. They can try to live for that next birthday or that next anniversary.
I was thinking about you the whole time while I was in there.
Thank you.
No problem, you did well.
No, I can cry. I'm just so happy.
Just the worry she must have felt every morning that, you want your husband there when you wake up, your best friend, and So now she got him back. So I'm happy for Anita.
You have to take your honey out on a date, you know.
They got it. They got it.
If he'd had open heart surgery, he would have been in the surgical intensive care unit for days on end and lots of rehabilitation afterwards. So this is remarkable. 11 times around is a mile.
I might take off here.
It'll be wonderful to see him coming around the corner.
All I had to do was step on the pedal. Back in the saddle again. How lucky can you get? This new procedure comes along just when I need it. I don't think I would have finished the year.
You look so good. You're just so fast. You look so good.
Baby, I dropped the ball. My hope is that real soon they will hit the road and get a few little trips in.
I don't think it's going to be too long the way he's going. He's ready to go.
I'm back.
Love you, honey.
Great life.
Great life. Now we have more of it.
Now we have more of it.